Welcome to another episode of Synergy Speaks. I'm Bushra. Today I'm joined by Brian Lee. Brian is our Senior Guided Surgery Consultant here at NavaGation. Brian, thank you so much for finally joining me today. I know you have a busy schedule.
I'm happy to be here. These videos are a fascinating insight into the workflows here at Absolute.
Well, it's good to have you. So in our previous videos, we talked a lot about planning from single implant cases to all-on-X hybrid cases and even overdenture cases. I want to dive deeper into more complex cases. I know you deal with these types of cases on a daily basis. Example of these cases include patients with existing implants. Doctors frequently ask if they can use these existing implants when planning their all-on-X cases. Tell me a little bit more about that and the workflow you usually follow when planning those cases.
Great question. From a planning perspective, we first determine whether we can utilize the existing implant from a restorative standpoint. So how much space do we have, or plan for new implants. There are two ways to utilize existing implants on fixed cases. The first is to pick up the implants at surgery. We can get an accurate positioning of the implants on the CBCT and tie them into the provisional. This is typically the simplest method of utilizing existing implants. The caveat is that it's going to be more invasive, and if the angle correction is required, the rotation of the implant remains unknown until surgery. The second way is to act as though you are restoring the existing implants. That means using scan bodies, analog impressions, verifying the model, establishing vertical, and utilizing a fixed scan appliance. Depending on the patient, we can combine a lot into one or two appliances. While this requires multiple appointments on the front end, it pays off on the back end.
That's good to know. Another question we get a lot is if a patient is a candidate for implant placement if they don't have much of an anterior ridge. Options we consider are pterygoids and zygomatic implants. Tell me your experience with those and how the NavaGation surgical solution workflow would accommodate them.
Great question again. We need a full face CBCT showing the zygomatic arch. For pterygoids, we just need to be able to see posteriorly. So, you need to have the field of depth and field of view that's required to be able to see those parts. When we have a full face CBCT, we can basically pull it into co-diagnostics and use its library of implants to dial in zygoma positioning. In surgery, we can provide pilot or fully guided osteotomy guides. Synergy Zygoma is constantly evolving to include supplemental processes and will continue to improve. My job at Absolute never ceases to require innovation and invention. I absolutely love what I do.
We always love working with you. Well, Brian, thank you again for joining me today. It was nice having you. If the doctors have any questions for you, how could they reach you?
Well, you can reach me at my cell, which is 919-491-3280, or my email, which is Brian, spelled with an I, at navagation.net.
Awesome. Remember, it's not just a surgery.
It's a smile synergy.